This one comes from one of our Twitter followers who writes, I bumped my leg on a spin bike at the gym weeks ago and I still have the bruise 3 weeks later. Should I be concerned? Docs, you two deal with bruises a lot, right?
We do. Yes.
What is a bruise is just bleeding into the tissue and it's old blood that hasn't been removed by our body.
Mm-hmm. Yeah, it's those blood cells that have leaked out of injured blood vessels and just are hanging out in the skin. And a bruise like that, 2 to 3 weeks is pretty normal, especially if it's soft. And many of us know that our bruises go through a life cycle and they go from red to purple to green to yellow. But I think when to worry is when your bruise feels really firm or hard or seems to be coalescing under the surface of the skin, because that's when we worry about something called a hematoma, which is actually not just leaked out blood cells that are percolating, but a true collection of blood that's clotting under the surface of the skin. And so in that situation, it sometimes will need to be drained out in order to resolve properly, or it's a very slow process that can give rise to infection.
In this case, this person knew exactly why they have the bruise. If you have multiple bruises and you don't know what's causing it, then that's a whole different scenario that's probably a telltale sign of something else that's going on inside you. For this gentleman, he should have applied ice immediately, and then down the line, things like cryotherapy. We know that hyperbaric oxygen helps. Down the line, heat may help. There are other little things that we like to give our patients, arnica pill form, and in a gel or cream form, bromelain we like. So there are things that we use in our practices.
But I think simple thing for people at home is to ice for the first 48 hours and then change to warm compresses so you can open up those vessels and clear out the bruises a little more quickly.
And maybe try some of these other over-the-counter things that we suggested.